Hello, my name is Dante Penapiti, and today I'm going to discuss my project called Optical Coherence Tomography Optical Density as a Predictor of Proliferative Vitreoretinopathy. Introduction. Proliferative vitreoretinopathy, called PVR, is the most common cause of rhegmatogenous retinal detachment surgery failure and is a complication that occurs in about 8 to 10% of patients undergoing primary retinal detachment repair. PVR is formed by an aberrant healing process brought forth by proliferation of RPE and glial cells, which form fibrocellular sheets, contract, and lead to significant retinal shortening. These contractile fibrocellular sheets may hold open retinal breaks, which lead to recurrent retinal detachment. OCT scans are used to evaluate cross sections of the retina, providing reliable measurements of the retinal layers as well as subretinal fluid accumulation. The optical density ratio, or ODR, of an individual's OCT scan can be calculated by dividing the OD of the subretinal fluid by the OD of the vitreous. This study may have the potential to aid in the prevention of PVR by examining ODR along with other predisposing clinical signs and appropriately modifying RD surgery with techniques such as combining a vitrectomy and scleral buckling or using different vitreous substitutions that one would not typically used for standard retinal detachment. The purpose of this study is to determine if ODR and OCT scans can have a prognostic value in identifying retinal detachment patients with a greater risk for developing postoperative PVR. Methods. A retrospective chart review was performed for 294 treatment-naive eyes that had surgery to repair a rhegmatogenous retinal detachment at the University of Kansas Medical Center during the past 10 years and had preoperative OCT imaging. Scans were examined independently by two readers. ImageJ software was used to measure the subretinal to vitreous fluid optical density ratio. Patient with vitreous hemorrhage or prior retinal detachment were excluded. Data collection included logMAR visual acuity, age, gender, and optical density. Results: 17 patients met the study inclusion criteria. 3 patients developed PVR and tractional retinal detachment. The average preoperative ODR in rhegmatogenous retinal detachment patients who did develop PVR was 0.77, and the average preoperative ODR in detachment patients who did not develop PVR was 0.72. This was not statistically significant with a p-value of 0.37. Age, lens status, and retinal detachment duration did not correlate with the postoperative PVR or tractional retinal detachment in this study cohort. If you could please direct your attention to Figure 1. This figure depicts a screenshot that was taken from ImageJ on which the OD of the subretinal fluid and vitreous were measured to calculate the ODR of the individual's OCT. Conclusions. PVR is a challenging cause of retinal detachment failure after retinal detachment repair. In this study cohort, preoperative ODR measurements were not statistically significant between patients who developed and did not develop postoperative PVR. The study's sample size was limited by its strict inclusion criteria and the unnecessity of preoperative OCT imaging in all retinal detachment patients. I would like to further reiterate that of the 294 retinal detachment patients that we examined retrospectively, 17 patients met the study inclusion criteria. The main issue is that most of these patients that we examined did not have an OCT scan that preceded the initial retinal detachment repair. The order of diagnoses and treatment that was required was to have a rhegmatogenous retinal detachment followed by an OCT scan, followed by repair of the retinal detachment, and then with a complication of PVR, of which 3 patients of the 294 met. This lack of an N did not give enough power to the study. Future studies could examine a cohort for which OCT scans are ordered on all retinal detachment patients prior to repair and are prospectively followed for the development of PVR in a specific period of time in order to examine if ODR can predict those who will face complications from PVR. Thank you very much for listening to my presentation. Hope you all have a great day.